Namaste, Dr. M.A. Krishnan. Read in newspaper that route map is planned and containment zone is declared in Palakkad because of Nipah, and those people who are not obeying the rules that people should not be crowding, like that some rules as before, and those who are not obeying it, they will be punished. So this is what I read. I don't know to what extent it is correct, but definitely they have framed some guidelines. So the same guidelines were applied before also, and I have also read a Facebook post of some doctor telling that such kind of unscientific, doctor of Western medicine telling that such unscientific guidelines are to be stopped. That's this kind of declaration of containment zones, etc. They are unscientific. So I was wondering why it was not discovered at that time that it is unscientific. So many people's lives and livelihood were completely sealed, and people who are in middle class and lower class, they have suffered a lot. There was huge financial crisis. They were unable to know how to make a livelihood. Such a situation was there. And they called it disaster, pandemic and disaster. So what I wanted to say in this video is that only one medical system is getting complete opportunity to declare and rule the country. Why it is happening? To declare guidelines and rule the country. There are other established systems in India, other established medical systems in India, which are having equality and freedom in making decisions and policies regarding a disease. So if a disease is emerging as a disaster, infective disease is emerging as a disaster, definitely each and every medical system has its independent role in analyzing the disease. Anyway, COVID-19, according to modern medicine, it was a new virus of that time. But what about the opinion of Ayurveda, scientific Ayurveda perspective, scientific homeopathy perspective? There are other medical sciences. They are medical sciences. They are not traditions. They are not beliefs. They are not cultures. They are not practices, blind practices. They are established medical sciences. Why these medical systems were denied access to govern healthcare policies in the country? This is what I am wondering. Still, it is continuing. Last time, what they did, they have done before 1 week. Again, containment zones are declared and route maps are made. People are stopped. People are not allowed to live their life because of fear of a virus. So every medical science is having different independent footing, not like everything has to lean on Western medicine and frame guidelines. That is stupid. Every medical science has its own independent approach. In science-based, evidence-based Ayurveda, we don't care for virus because Ayurvedic science emphasizes to completely look upon the host factors, host immune mechanisms. Ultimately, any infection is happening because of immune response. And therefore, the immune system has to be handled carefully, judiciously to eradicate the infection. So, SBEBA, science-based, evidence-based Ayurveda, has very highly scientific. Compared to Western medicine, it is unimaginably scientific and unimaginably much more logical in preventing and handling viral infections. Not only viral infections, all the infective fevers. We were ready to serve the country, and we were serving country at that time online consultation. We have trained Ayurveda doctors who are willing to voluntarily help, to help the mankind online with non-medicational first aid. We were not employing any medications. We were doing first aid program for the first time in the history of world. Viral fever first aid consultation. We are not non-medicational first aid program. That's what we were rendering. We are still continuing the program where people from all over the world can avail our service by agreeing to our terms and policies. And people are recovering in viral fevers of all stages. People are recovering in less than 5 days. Less than 5 days. We have treated severe cases also. We are documenting it not only in this online consultancy. Offline also, we are helping all the patients with all kinds of infective fevers. I'm telling, online we were doing this, and we have submitted a proposal to government also that we are ready to help mankind in such kind of disasters. Scientific Ayurveda, science-based, evidence-based Ayurveda has highly scientific and on the target policies. Our scientific refers to the guidelines within the science to understand a viral infection or a bacterial infection, whatever it is, and how to efficiently modulate the immune response and enable the immune system to eradicate the infection. This we have done research, basic and applied research in Ayurvedic science, and we have formulated guidelines in science-based, evidence-based Ayurveda. So when we are submitting proposals, who is to take up that, who is to call upon discussion, who is to implement in a at least in a short population and see, who is to see the data that which we are submitting. It is ultimately, it is the government, of the people, for the people, by the people, who are to be receptive and open and equal in their attitude to all the medical systems. During COVID period, we all, me and my husband, individually we have suffered a lot. We were not ready for this experimental drive. We wrote a formal letter to the authorities that we are Ayurveda doctors. We are confident in preventing and curing this disease. It's not a new disease for us. We have given an authentic letter in reply to this mandate. So they have asked us to stay home. The government, we are working in a government college, Government of Puducherry institution. They have asked us to take earned leave and sit indefinitely for long, for the reason that we didn't allow our body to be subjected to this experimental drive. And the authorities in the college have defamed us through newspapers. Just imagine, we are Ayurveda doctors, we are confident in our methodologies to save mankind from infective fevers. When we are confident enough to do that, we are blocked from doing our service. We are blocked from doing our duties. We are blocked from, even we are led to a completely chaos state of mind. We didn't know what to do. We are not allowed to go to college. We are not allowed to do our works. It is very pathetic. When we went back, the punching machine was off. For us, it was not active. For others, it was active. Those who are vaccinated, punching machine is active. We were completely confused. Our payment was withheld. Our payment in a government institution was withheld for 2 months without any official communication. Can you imagine this? The level of torture that an Ayurveda doctor and faculty. I'm having 20 years experience. My husband is having 22, 23 years experience. So we had this kind of problems. So it is really necessary that government should be knowing that all the medical sciences have their own independent footing in their own established medical sciences. If Ayurveda is banned system in India, okay, then just ban everything. Ban the practice of Ayurveda, ban Ayurveda professional education, ban all the hospitals and clinics. We will go for another job, whatever we do. But as long as it is an established medical science of the country, it is a recognized medical science of the country, we are having our independent rights. We are having our rights to make decisions for mankind. Because we are doctors, we haven't learned any tribal medicine or any things which are considered as beliefs handed over through generations from our forefathers. We have struggled a lot. We are still struggling to understand the science. Our science is a deterministic science. It is not a probabilistic science starting from an unknown compound. We have to work such a high level to understand our science logically and apply it sensibly in mankind. And in SBEBA, we have framed guidelines to understand viral, bacterial, and other infections, and on the target manage them. This proposal we have submitted to government. Still, the proposal is always ready. We are serving mankind. We are helping people to recover from infections amazingly faster than when they are on other anti-ing drugs. So my humble request to government is that every medical science should be given equal opportunity to govern healthcare policies. Please don't shut down our lives. Please don't shut down our livelihood. It is like I am a doctor, but there are many people I can do independently according to my will in my healthcare decisions. So, like that, there are people who want to know the reality what every medical system can offer in their healthcare in the matter of their illness. So please don't be discriminative. Like one medical science is only, it is now going like Ministry of Health is equal to Ministry of Modern Medicine. Let it be not like that. Other medical sciences are to be included in healthcare policies. Thank you.